So we are going to do Epstein-Barr virus, which comes in herpes virus, and it was first isolated from Burkitt's lymphoma. So it affects beta cells of immune systems, and they transform it in such a way that it multiplies continuously. It doesn't stop multiplying, and it is prevalent in 80 to 90% of children. If once an infection persists of Epstein-Barr virus, if the person has encountered an infection with Epstein-Barr virus, then it is present for life. The infected person is shedding in oropharyngeal secretion. So there must be an intimate contact, oral contact with the infected person, such as in kissing. So one of the type of its infection is also known as the kissing disease, which is the glandular fever. So it does not spreads from aerosols or droplets, and there are three kinds of infections which can be caused. First is glandular fever, which is also known as kissing disease. Next is disease or infections in immunocompromised. And third is Epstein-Barr virus associated malignancies. So in the glandular fever, it is self-limiting disease prevalent in adolescents or children, and in adults, what can be the cause? So it is affecting the lymph node. Then there can be a lymphadenopathy, sore throat because of the oropharyngeal involvement, and fever and abnormal lymphocytes. Incubation period is 4 to 7 weeks, and it lasts for only 2 to 3 weeks. What happens in this is it is affecting B lymphocytes. So B lymphocytes will start producing IgM, immunoglobulins. Then therefore there will be IgM bodies, high level of IgM in the blood. So we can detect by the presence of IgM in the blood. Next is it can cause lymphoproliferative disease in infection in immunocompromised, such as AIDS. It can cause lymphoproliferative disease. Now comes the malignancies. So we have malignancies such as the Burkitt's lymphoma. The Burkitt's lymphoma is only prevalent, or it acts in Africans and New Guinea. In Africans, more prevalent, and it occurs as endemic or sporadic type. There are multiple copies of Epstein-Barr virus in the cells of Burkitt's lymphoma. Now next is lymphoma. Lymphoma can also occur in immunocompromised persons, such as the transplant patients having transplant or HIV infected. Other is nasopharyngeal. It is also prevalent in males of Chinese origin in Southeast Asia or East Africa. So basically, this Epstein virus is most prevalent in the African region, and these are present in malignant epithelial cells of the tumor. Epstein virus are present in epithelial cells of tumors in the nasopharyngeal carcinoma.